Well, one thing I do want to say directly to future and current patients is if you're someone who lives in a bigger body, I want you to know that your weight is not the issue, and that there are things that we can do together to focus on your health and your experience in your body that will hopefully allow you to bring some peace. The unfortunate reality for a lot of individuals living in bigger bodies is that they've had negative experiences with doctors blaming their weight for nearly all of their conditions. I had a patient recently tell me that when she went in for an ear infection, her doctor told her to lose weight for the ear infection. And when we think about that medically, logically, it doesn't make a lot of sense. Unfortunately, there's been this stigma that's been so common in our country that blames a lot of underlying health conditions on weight. And when we look at the research, that's often not actually true, that there are other underlying conditions or other factors that are contributing to health or not. And so I like to really validate the patient's experience in their body and meet them where they're at with their goals. But I often find that trying to take the number on the scale off the equation when we talk about things like pain or mental health is very freeing for people so they can start to be in their bodies. I also really like to dig into the literature around health at every size work, because I think that while some of it feels really intuitive for folks who've lived it, that the dogma has been really specific for a long time with other healthcare providers, or even some individuals who've really internalized that it must be my weight, that's the problem. So I love to educate patients and even some other doctors sometimes on the literature around. So for example, low back pain is actually not associated with weight. There are a lot of causes for low back pain, but weight specifically is not one of them. So being able to take that off the table can be, it opens up a lot of treatment options in a way that it's not just weight loss. And I don't prescribe weight loss pretty much ever. I want to, again, work with patients to meet their goals, and we can talk about that as long as we're also focusing on health, and I mean mental health, emotional health, and physical health too, because we know that restrictive dieting and things like that tend to be really significantly detrimental to mental health, emotional health, and physical health.